All right, let's see. Thank you. Can you hear me okay?
We can hear you just fine, sure.
All right, I'm going to share my screen. Well,
Okay.
thank you so much. Such a pleasure to join you and to talk about something that is near and dear to my heart. I've been practicing. Let's see the host. Okay, practicing naturopathic functional medicine for men's health and urology. It's coming on 20 years. So it's funny, like it's funny when you're having fun, how quickly time flies, right? My kids are now, I have an 18-year-old, my oldest, so everything is just flying by. So I've been practicing for 20 years almost in this very narrow. So I've decided 25 years ago to go narrow and deep into not being a generalist or a general practitioner of integrative and functional medicine, but more so of being focusing in this area of urology and men's health. I just, the first, the first organ or the first, let's say, biological tissue that I learned about growing up was the prostate. And that's because my father, by the time I was 10 years old, he was already, when I was 10 years old, my dad was already about 57 years old. And because he was about 47 when I was born. And he already started having prostate issues. And so I remember before hypertension, before heart, before him talking about his prostate and my prostate is aggravating me. Oh, well, I know at some point I'm going to die from prostate cancer because my father died from prostate. Oh, prostate. It was just every day. And I didn't care about a prostate at the time. Later on and through my training, I just fell back into urology and all the things that I learned in naturopathic medical school to apply for, urological conditions. So but my practice at NYU is it's all related to mostly prostate issues and men's health and low testosterone and things of the sort. And just by nature, constantly seeing the same things, I think that sometimes you get to figure things out and figure out what works for men as they age so that they don't have to urinate 5 times a night anymore or have these prostate issues or lower the risk of prostate cancer, which is the goal. So I'm going to present to you all. I'm going to share my screen and we're going to talk about this pesky prostate. This pesky prostate. Let's see. And I'm going to share. Bear with me here. Okay. I'm almost there. Let's see if we can.
Dr. Espinosa, yeah, go to slideshow. Perfect.
Yeah, got it.
Great.
All right. We're good, right?
We're good.
All right. The pesky prostate. So what's the purpose of this little organ, or sometimes not so little, right? So the reason why there's a walnut there on my front page is because a normal prostate is about the size of a walnut. It's about 20 grams. As a man ages, it seems to get bigger. Not in all men. I just had in my office a 66-year-old man with a 22-gram prostate. And it's like, wow, this is the smallest prostate I've ever seen on a 60-plus-year-old man. So there's a lot of reasons why it grows and so forth. But in most cases, the size of a walnut is about the size of, and it resembles a prostate. I remember being in the OR in my early training at Columbia Department of Urology when I went to the to observe surgeons remove prostate for prostate cancer, and literally there is no there is no food out there or nut that resembles the prostate like walnut. It's pretty remarkable how even its shape. So you don't have to necessarily, as you get older, have prostate issues. You can reduce the risk. Or if you do have prostate issues, they can be managed effectively, naturally for the most part, or integratively. there are times where, look, for the last 11 years, as I've been with my urology colleagues at NYU, I decided to do the following. I said, well, I think I know a lot about natural methods and diets and lifestyles and botanicals and herbs for the prostate. I think I want to learn more about the conventional treatments and dive deep into prostatectomy for prostate cancer and radiation. How does it work? And TERP for a big proc for BPH, green light laser for BPH, PD5 inhibitors, Viagra, Cialis for erectile dysfunction. I want to learn at more than anyone on the conventional side to see what actually works. What actually works? As most natural doctors, I definitely, first of all, I'm super biased towards natural approaches, natural methods to keeping a young prostate and just staying young as a whole. I don't remember the last time I took an antibiotic or a painkiller. So that's my bias. But my patient who's coming into my office doesn't care about my bias. They care about getting better quickly or as soon as possible. And they want natural methods, but sometimes conventional methods are applicable and work well. So truly my practice is an integrative approach using primarily the principles of naturopathic and functional medicine, looking at the body holistically. I always say the lower part of the body is actually connected to the upper part of the body, right? The upper half. So that waistline, it doesn't separate the lower half of the body from the upper part, right? They're all connected, and looking at things holistically to improve patient outcome in my case. So my presentation today is discussion of this pesky prostate and some of the things that I think you should consider doing to keep your prostate well and healthy and young. All right, here we go. Enjoy the show. First, disclosures and affiliations. I am co-founder and medical director of XY Wellness LLC. So that's that. You're watching a movie and you can't watch a movie for more than 30 minutes before having to go to the bathroom. This is called LUTS, or lower urinary tract symptoms, which comes with urinary frequency and urgency. And when you have to go, and you can't hold it, right? And oftentimes in men, that's associated with prostate problems. But the reality is that that's not always a prostate issue. That can be a bladder issue. So the prostate is not always the problem. It can sometimes be overactive bladder, just like it is in women, right? So we'll talk about that in a second. And I can't. Since I've been in this world of urology for over 20 years, I'm very sensitive to the sound of urination as it hits the bottom of a urinal or a toilet. So as an example, I have a 10-year-old son, and when I hear him, urinating, and that's a strong, right? It's a strong sound that it makes as it hits the bottom of the toilet. Wow, I don't think I pee like that anymore. And certainly when I'm in public places, I'm listening and I see the grimace sometimes of people. It's an awkward situation, but welcome to my world of urology. I listen to their urine, and I'm thinking, wow, this guy's probably struggling with a big prostate. So this is just, I'm very hypersensitive to anything that has to do with urination at this point. So, all right. So 70% of the prostate is glandular and 30% is muscle, smooth muscle. Okay. So what? What does that really mean? The glandular component is what makes the part of the semen that contains also PSA. right? That molecule that we call a patient-stimulated anxiety molecule, right? PSA, because it's the prostate biomarker that gets men really anxious and nervous when they get this test. So that's the glandular part. Then there's a muscular part, which is about 30% of the prostate. Why is that important? It's important because the type of muscle that's in the prostate is called a smooth muscle. So the body has three types of muscles. It has skeletal muscle, right? So these are the muscles attached to your bones that allow you to move. And those are voluntary muscles. So when you want to move your right arm, you move your right arm, no problem. You have cardiac muscle. So that's a different type of muscle of the heart that's involuntary. And then you have smooth muscles these are the muscles around your arteries and your blood vessels, bladder, and prostate. And the reason why that's also important is because when you are stressing, what happens? Your blood pressure goes up. Why? Because stress chemicals are stimulating the blood vessels, and then so the blood vessels constrict, causing an elevation in blood pressure. Blood vessels are smooth muscles. What else is smooth muscle? Prostate muscle. So when you're stressed, you sometimes also squeeze the prostate muscles. So many of these urinary symptoms that are derived from the prostate, it's not so much that the guy has a big prostate. It's a matter of that squeezing because there's either excess inflammation going on in the prostate that's squeezing the urethra, that's the tube that brings out the urine and the semen, or is the smooth muscle squeezing because there's a stressful situation. So stress has an effect. And what's also stressful to the body, this is not just emotional and psychological stress, this is also physical stress. So excess sitting is also stressful to the prostate. And notice, if you're a man listening, when you're sitting down for hours at a time and then you go pee, what happens? For most men, not all, but most, the urine flow is weaker, right? Because excess sitting is a little bit stressful to the prostate. And it's a result of this smooth muscle of the prostate squeezing around the urethra. Okay? So I want you to, next time you go to see the urologist, I want you to ask better questions. And one of the questions is, well, I may have a big prostate, but is that what's causing my urinary problems? Because you can have a small prostate and still have urinary problems, or you can have a big prostate and not have urinary problems. Okay, so that's why. So the fact that the prostate is 30% muscular is a big deal here for the reasons that I just mentioned. All right. This is just a side view, sagittal view of the prostate. So as you can see, we have the bladder, and then the bladder right beneath or inferior to the bladder is the prostate. Through the prostate, you have the urethra that brings out the urine, right? So any squeezing that happens around this area will cause blockage, and there will be a weaker flow. And there's many reasons why there are weak flows in men, okay? There's certainly, it can be a big prostate. What I'm saying is that in my experience, oftentimes it's just not. You can have a big prostate and not have urinary problems, a weak stream. But it can be just tightening of this area of the prostate, of the urethra, okay? That causes a weak stream. If there's if the weak stream is not addressed, then that causes backflow of urine into the bladder. And then eventually that starts causing problems of the bladder as well. So now you have both. You may have an underactive bladder, or you may have an overactive bladder, depending on the situation. Okay. The other thing that I want to mention is that this is the rectal area here, right behind the prostate. That's the rectal area. And of course, the reason why we give men that wonderful exam that most men just love, sarcasm, is when we put our index finger through the rectum to try to assess only what this area of the prostate feels like. So when a urologist is checking for the prostate through a DRE, digital rectal exam, we're only really feeling the posterior side of the prostate. We don't have access to the anterior or the middle area, right? And from there, you're able to feel different things, whether if the prostate is boggy or soft or hard or nodules. Nodules are like your knuckles. So when you feel your knuckles, that can signify prostate cancer or just calcium deposits in the prostate. Okay. And so the main function of the prostate is to produce about 40% of the semen that it's produced for fertilization. And again, PSA, which is the biomarker that we test for, is also produced in the glandular part of the prostate here. And that all comes out in the ducts. So actually, this is another good point to mention. So the glandular part of the prostate produces semen and PSA, which comes out in the semen, and that PSA biomarker comes out in the ducts, not in, it shouldn't be in the bloodstream. It only comes out in the ducts, so that then it's released in the semen. So PSA is it's a prostate biomarker that should not be released in the bloodstream, and it's only released when there's some sort of thing going on in the prostate. There's a lot of benign reasons why PSA is released, and we're going to talk about all that later. But I just want to give you a little overview here. All right, so the normal size of the prostate is about 20 grams, is inferior to the bladder. The rectum is right behind it in the perineal membrane. And this is all part of what we spoke about just a minute ago. All right, what are the top 10 diagnoses in men over 50? Well, 2 of them are enlarged prostate and prostate cancer. Of course, anything related to heart disease is number 1 and 2, but an enlarged prostate is a big component, no pun intended, of what men are diagnosed with after the age of 50. So PSA, briefly, things that can cause a high PSA is, yes, cancer, prostate cancer, BPH, an enlarged prostate, really any activity of the prostate, any disturbance of the architecture of the prostate, whether it's a digital rectal exam. So when you go to the doctor, and this is one of my frustrations in clinically, you should never get a blood draw after a digital rectal exam. The digital rectal exam should come after the blood draw. And I see a lot of practitioners sort of not getting that right. When you do a digital rectal exam, this is causing a little bit of disturbance depending on how rigorous the rectal exam is of the prostate. That's going to cause PSA to rise. So that will cause PSA to rise. Ejaculating within, let's just say, 48 hours will cause the PSA to rise. Why? Because when a man ejaculates, the expulsion of the semen is from the prostate, actually from the muscular part of the prostate. That is the function. It squeezes and it brings out the semen. But that causes some kind of disturbance of the architecture of the prostate, and that will cause the PSA to rise as well. Prostatitis, any inflammation of the prostate, or some sort of infarct where there's not enough blood flow going in to the prostate will cause that. So the PSA is produced in the glandular part of the prostate. There's some PSA that seems to be secreted a molecule that resembles PSA in a salivary, in a saliva, and breast tissue, found in semen, urine, and blood. And what it does is a protease, which means that it's an enzyme that liquefies semen. So when a man ejaculates, they expel semen, but semen quickly coagulates and clumps up, similar to blood. So the purpose of PSA is to liquefy the semen so that the sperm cells can be released and move freely for conception. But we know that PSA is poorly sensitive to prostate cancer and not so specific to prostate. So this notion of using PSA for prostate cancer screening has been debatable within the last 7-8 years. Okay. Now there's better things out there, but PSA is still a very good biome, and we're going to talk about that in a second. But the bottom line is, with this slide, is that PSA in terms of being used as a diagnostic tool for prostate cancer, there's just a lot of evidence that within the last 30, 40 years, it's been overused and abused and misused. So now we've had people who've been treated for prostate cancer who never should have been treated, and we've had biopsies on people that should never have been biopsied for prostate cancer. So it's a poor biomarker for prostate cancer. I would say that it's not to be used. So I disagree with the notion of let's just not use PSA at all. I disagree with that notion. But it's a matter of how you use the PSA biomarker, not using it. So just you get a number back, that doesn't mean right away biopsy. You use that number as a totality of a bigger picture to try to figure out if the patient has prostate cancer or not, or there's something going on in the prostate that's unrelated to cancer. And some of the ways to improve sensitivity includes PSA velocity. So that steady increase in PSA number within 3 to 6 months is valuable information. Also, it's age dependent. So this notion of 0 to 4, when you look at a lab test where it says the normal range is from 0 to 4, is nonsense. Because if you're 45 years old and your PSA is 2, that's 2.5. That's high for 45 years old. If you are 60 years old and your PSA is 5.5, then that may not be a high number. So just the absolute value itself of that number, it's not that great. And only about a quarter of prostate biopsies reveal prostate cancer. Even if there's prostate cancer there, when the PSA is used to as a screening tool. So it's imperfect, but there's ways to improve its sensitivity and specificity, age adjustment, velocity, free PSA. You also see in a lab test, you see free PSA as another tool, free PSA percentage. So anything under 25, the lower the number, the higher the likelihood, but there's a lot of false positives there as well. And then PSA density. PSA density is a calculation where you get the size of the prostate and you divide that over the PSA value and it gives you a number. Anything above 0.15 indicates that there's probably prostate cancer there. So the bottom line here is PSA is a decent tool. I use it, but I use it very carefully. And of course, when patients come see me, I don't want them to get a biopsy unless they absolutely need it. And so we go through all the steps to figure out if they need a biopsy or not. Last thing I'll say is the gold standard way to diagnose for prostate cancer is through a prostate biopsy. There's no other way. So even though there is great technology and MRIs and scans and PSMA scans and PET scans, out there, none of these are tools that are used to diagnose someone with prostate cancer. You have to get a biopsy. There's no other way. So my goal is, again, to, in terms of my assessment, is to look at many things to figure out if the patient needs a biopsy or not. And if, and oftentimes, I gather all the information to determine if they need it or not. So. Okay, we talked about its poor sensitivity. Sensitivity of biopsy screened is 60 to 80% at best. This notion of the cutoff being 4.0 is not an absolute indication for a biopsy. So if, again, so we gave you several scenarios already, but let's just say a 53-year-old man with a PSA of 4.5, that will not prompt me to suggest for a biopsy. So there are many factors there. And there's many scenarios that would cause a rise in PSA. Catheterization, if you're catheterized, that will cause a high PSA, an increased rise in PSA. So there's a lot of, I think stress can cause high PSA. I typically get men to sort of do 5 deep diaphragmatic breaths before their blood draw, so that, despite the fact that this number is it's been shown to be imperfect for prostate cancer, the men still stress over PSA. It's just what it is. It's a psychological thing, and so it's a decent thing to try to keep that number down. And that number does tell me something about prostate health, not just prostate cancer. So it may be inflammation, and so forth. So typically with the natural protocols that I prescribe, the number of PSA can be lowered significantly, I think, which again signifies prostate health, not just as it relates to prostate cancer. All right, here we go. So PSA density, we spoke about. Anything above 0.15 is associated with prostate cancer. Then we look at PSA velocity. Roughly, if PSA increases more than 0.75 a year, that's something to focus on. Roughly, it depends on many factors. Then we have PSA free percentage. Anything lower than 10% is more likely to be prostate cancer. Anything higher than 25% is more likely to be related to a big prostate. And then there's age-specific thresholds. All right, facts about BPH. So this is benign prostatic hyperplasia. This is where you have just a big prostate. And so a big BPH is not associated with prostate cancer. So you can have a big prostate and not have prostate cancer. BPH may not be associated with urinary problems, or it may, depending if the middle part, where the urethra is, if that gets bigger and it kind of squeezes on the urethra. Okay. BPH may not be associated with any other problem. If the prostate, however, is really big, and I'm talking about, we said that normal is 20 grams, right? Size of a walnut. Let's just say the prostate is the size of an orange. Well, now, though it's not associated with prostate cancer and other life-threatening health issues, it will push up on the nerves that surrounds the prostate that innervates the penis, and it can be contributory to erectile dysfunction, because now the nerves are being squeezed because the prostate is so big. So the only thing in a very, 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 very big prostate that BPH is associated with is erectile dysfunction. So the definition of BPH is hyperplasia. So it's an excess accumulation of prostate cells. in the smooth muscles, the stromal areas of the prostate, and in the transitional zone. The transitional zone is the area that surrounds the urethra. All right. So the IPSS is the questionnaire that most men are familiar with when they go to the urology office. Is the the prostate symptom questionnaire, and that's what's used. Men from Southeast Asia seem to have smaller prostates than men from Western countries. I don't know why that is. And honestly, I don't know that it really matters, again, for reasons that I've mentioned. And most people want to say, well, you know, Asians are, you know, they have lower risk of prostate cancer and smaller prostates because they eat more tofu, or because they have more of a vegetarian lifestyle or vegan lifestyle, or they also smoke a lot more than we do. So I don't think it's that simple to say that Asians have smaller prostates and lower risk of prostate cancer because of their diet or something, or, you know, because they smoke a whole lot more than we do. So it's hard to say. And BPH is associated with low androgens and high estrogen. So the notion that testosterone it's the cause of BPH is not true. High estrogen levels cause BPH. And if you noticed, you never seen a 25-year-old guy with big prostate. And a 25-year-old guy, male, right, has high testosterone, very low estrogen, right? As men get older, that ratio keeps changing. So now testosterone is decreased and estrogen is increased. So if testosterone was a problem for the prostate and even prostate cancer, then you would have 25-year-olds with prostate cancer and BPH. That's not the case. So estrogen, and I think that's another area that we're missing out on, because I don't see a lot of my colleagues looking at estrogen as a possible factor in an increase in BPH. So, all right. So normal. So on the left-hand side, we have a normal situation. We have a bladder, nice detrusor muscles, right? The detrusor muscle is the muscles of the bladder, nice and thick. Prostate opens when it's going to urinate, right? And this causes a nice flow of urine. In a situation of BPH, if the prostate is too big and the transitional zone also, right, this is the area around the urethra, also squeezes on the urethra, then you causes several problems. It causes urinary retention, so you have a hard time peeing, and then it causes backflow of the urine into the bladder. Now the bladder is overworking to try to pee, which causes hypertrophy, right? So it causes the muscles of the bladder starts increasing in size, and it starts not working properly, right? So this is why any obstruction, urinary obstruction, whether it's related to BPH or any other causes, it needs to be treated. So once you start, my suggestion is you be mindful of your body. When you go urinate, look, your urination is going to weaken with age. That's not a problem. The problem is when it's significantly, when you hear just a dribble consistently. But here's a takeaway for you. It's okay to have just a very weak stream once in a while. Okay, once in a while is okay to have a little bit of a weak stream. The problem is when it's a weak stream all the time, consistently. For example, most men after a certain age, that morning pee is a little bit weaker. That could be normal. But if it's a weak stream in the afternoon, at night, throughout the day, then that's something to look into. So then you want to address that early, naturally, hopefully, but in some way. even medically. All right, so BPH symptoms cause a weaker stream, hesitancy, it's intermittency. So there's like stop and go, dribbling, incomplete emptying, dysuria, where there's a little bit of discomfort from urinating, and nocturia, which is nighttime urination. What causes an increase? So, Dr. Geo, my prostate is going to be a problem anyway as I get older. There's nothing I could do about it. I'm not sure. Is it nature or is it nurture? I don't know. But I do know that as men get older, they typically get more unhealthy and they start developing other types of problems like metabolic syndrome and hypertension and cholesterol and all these things. And all these things seem to contribute to all prostate problems, not only BPH, but certainly BPH. So men with lower urinary tract symptoms have higher, let's say, hemoglobin A1C. Hemoglobin A1C is that biomarker that you look at to see how your blood sugar is within the last 3 months, right? So hemoglobin A1C, but your urologist is not gonna look at hemoglobin A1C, because now we're talking about looking at things more holistically, and it's not how it works. Now, I'm not knocking urologists. Let me be clear here. They're very good in just focusing on helping you with your prostate problem, and through pharmaceuticals or surgical procedures, some of which actually are very helpful if you need it. But they're not going to look at hemoglobin A1C, C-reactive protein, all these other biomarkers that are absolutely essential to figure out what's going on with your prostate. Okay, so obesity, the heavier the person is, the higher the size of their prostate on average. The higher their waist to hip ratio. Guys with big bellies have a higher prostate, a bigger prostate. C-reactive protein, the higher that is a C-reactive protein, of course, is an inflammatory marker, biomarker that you can get from blood tests. There's a higher probability of BPH, and sometimes there's bacteria and viral strains found in biopsy that are. So the idea here is, how do you create a microenvironment in your body that's hostile to all these bugs, including COVID, but these other bugs that are in your body, and how do you look at reduce inflammation and things like that keeps you stay fit, stay keep slim. How do you do that? And this is where, when we talk about lowering the risk of prostate problems, this is a major area. And again, nature or nurture? I don't know. I think it's mostly nurture. So who's at risk of BPH? People that are over 50. But again, 50 is not old. Okay, I'm not only saying that because I'll be 50 this year. I really mean that 50 is not old. This is completely objective. 50 is not old for a man. So I think it's a lifestyle problem, right? Why we age. So anyway, but studies show that 50, but yes, on average, in a general population, as men get older, they get older. As men get older, they start aging more, right? Metabolic syndrome, this is a scenario with hypertension, high lipids, glucose problems, big waist, insulin resistance, right? So that is a problem for BPH. And prostate growth is 47% in men with type 2 diabetes, 17% in men with hypertension, and 36% in obese men, and so forth. So again, these things, you have to look at the body systemically. BPH, erectile dysfunction, these are systemic problems. This is not a local problem. This is a systemic problem. IPSS, we spoke about that earlier. Inflammation and BPH. So there is all these inflammatory biomarkers that we would look at. C-reactive protein actually covers quite a few of these. How about hormones? DHT is significantly increased. So DHT is, so your body converts testosterone to DHT, and DHT seems to be a contributor to BPH, but so is estrogen, as we spoke about earlier. All right, and this relationship with estrogen, testosterone, the ratios. So when I'm going to give a talk, today is a talk day. I'm going to give several talks. In a few hours, I have another talk with a group of doctors. We're going to talk about hormones and men's health. And the big takeaway there is that it's not only the absolute number of testosterone or estrogen, is the ratio between one and the other that matters, right? The ratio between two hormones, estrogen and testosterone, testosterone and DHT, testosterone and free testosterone. Those are the things that matter. Anyway, so here is the same scenario. The bottom line here is that estrogen is contributory to BPH, and that needs to be addressed and looked at. So what are some of the herbs that are and botanicals that are used for BPH? So saw palmetto is actually, so it's interesting because I took, as a naturopathic doctor, I did extensive research on botanicals in general. And I'm also part of the American Herbalist Guild, et cetera. Saw palmetto is an excellent botanical for men and women. So some time ago, saw palmetto was connected just for prostate. And so when you hear saw palmetto, you think prostate health, but it's good for urinary dysfunction in both men and women. So it's been used for decades, if not centuries. And it has no effect on PSA values, meaning that it doesn't falsely lower PSA. Why am I saying that? I'm saying that because the pharmaceutical drugs, 5-alpha reductase inhibitors, so this is your finasteride and your dutasteride, Proscar is a trade name, and Avodart, they are 5-alpha reductase inhibitors, but it also falsely lowers your PSA. What that means is that if your PSA, let's say you go to the doctor, you're a 62-year-old man and you are on finasteride, and your PSA is 4.5, that really means your PSA is like a 9, because if you're on finasteride or any of these drugs, because these drugs falsely lowers PSA. Saw palmetto does not do that. Okay. Numerous studies looking at saw palmetto and its efficacy. The bottom line is this: and for mild to severe symptoms, it might not be as effective. For moderate to severe symptoms, it might not be effective. In cases where it's just mild urinary problems from the prostate, it might be effective. In my practice, I don't use saw palmetto a whole lot, honestly. I think other things are better that we're going to talk about. I do think that it might be helpful, but only as a standalone, in just not in a formula. Probably at dosages about 720 milligrams or so a day. But I do think that a good formula works better than just saw palmetto alone. But saw palmetto in a formula I would not use. I will use it as a standalone, and then maybe other things. But again, in my practice at this moment in time, it's not my main go-to. Curcumin is one of my main go-tos. Curcumin. Curcumin is from the turmeric spice, and it's just a very powerful anti-inflammatory. And anytime you have a good anti-inflammatory molecule in your system, good things happen. And curcumin seems to work very nicely for BPH and all prostate problems, actually. So the big three are BPH, prostatitis, and prostate cancer. And it seems, and curcumin seems to help with all three of those prostate issues. So you get a lot of bang for your buck with curcumin. Curcumin is one of my main go-tos, and I give curcumin to most of my patients, unless they have they get some GI distress from curcumin, which most people don't, but some do. Pygeum. So many of the formulas have Pygeum africanum in it, but I don't use it because, according to my friend Dr. Eric Yarnell, who's a herbalist and a men's health expert as well, he says that this is an endangered species. So I just don't use it. And honestly, we don't need to. There's other great things to use. Curcumin is one of them, and we'll talk about others. Beta-sitosterol. So many studies have shown that this is beneficial. Beta-sitosterol is a chemical found in saw palmetto and many other botanicals and natural agents. It's been used, and sometimes you do see this in formulas. It hasn't been studied for a while, but many of the older studies that looked at it shows that it may be beneficial in helping with urinary problems. All right. What's the diet and lifestyle for BPH? You know, flax seeds, at least in rats, seems to help. Not the oil. I would stay away from the oil. And I know that there is an old treatment for prostate cancer called the Budwig diet. And pretty much that was a flaxseed oil and cottage cheese diet for prostate cancer. I think that Budwig and its practitioners back in the day, this is what they had, but I think that information is outdated and it's no longer what I would, or anyone would suggest that I know for prostate cancer. But the flax seeds, the seeds themselves are beneficial. And so I would recommend that. Physical exercise. There's a strong association with physical exercise and BPH and lower urinary symptoms. And selenium. The type of selenium that I use is from selenized yeast. I don't use things like selenium methionine. I think that too much selenium methionine can increase possibly the possibility of prostate cancer, but I use the selenized yeast, which has selenium methionine, but other forms that seems to be protective. And that's from research that in the selenium and vitamin E trial. I may talk about that in a little bit, but I don't want to get bogged down with the too much scientific jargon. But selenium is from selenized yeast is the better approach. All right, prostatitis. Let's talk about that. There's 4 types, right? There's bacterial prostatitis. This is a scenario where guy comes in, he has fever, and he has, fever 101, 102, and he urinates, and it burns when he urinates. There's some sort of fluid, the thick fluid that comes out of the urine as well. Again, it burns, painful, feverish. That's bacterial prostatitis. Then you have category 3, which is no bacteria, and that accounts for up to 95% of the prostatitis that I see, and certainly the ones that people experience. So I'm going to focus a lot on vitamin. I think I need to take a little swig here. Excuse me 1 second. I'm going to focus on category 3 prostatitis mostly. All right, so pelvic pain is a serious symptom. particularly in the perineal area. That's the area between the scrotum and the anus, or pain in the scrotum and rectum, penis, lower abdomen. There's also urinary symptoms as well, things like your urinary frequency and urgency. If typically category 3 prostatitis or chronic prostatitis comes with both pain and urinary problems, not just pain. So the pain can be, if it's only in the pelvic area, it could be just pelvic pain. But if it's combined, if the location is in the perineal area or testicles with urinary problems, then that's probably more prostatitis. And then there's ejaculatory symptoms that are there also. Oftentimes it's premature ejaculation or painful ejaculation or just erectile dysfunction. How we look at it is, as doctors, is we take a medical intake form, the NIHCPSI, which is a questionnaire similar to IPSSI, that we look at. During the rectal exam, it's a little tender, so the patient is like jumping off the table. Look, a digital rectal exam, a prostate exam, is never comfortable for anyone. No man wakes up in the morning ever excited about getting a finger up their butt, right? However, in a situation when I'm doing the exam, I'm asking the patient, I know this is uncomfortable, but I'm not looking for discomfort. Let me know when it's painful. And so oftentimes it's actually painful in prostatitis, not in BPH or any other prostate problem. And then a PSA should not be taken if a doctor assumes, if the physician assumes that prostatitis is the problem, he should not take PSA, because the PSA will likely be high and it will just cause unnecessary anxiety. Oftentimes a young guy like this, 25, 30 years old, but I've seen guys in their 50s and even 60s with chronic prostatitis as well. So it could be any age, but oftentimes the main prostate problems that occur in younger men, mid-20s and 30s, is prostatitis. It's not BPH and it's not prostate cancer, it's prostatitis. Let's see. One of the go-tos is quercetin. I love quercetin. Quercetin, and it's a good, as an aside, quercetin seems to be protective against COVID as well. And you might have seen that, but quercetin is an excellent anti-inflammatory. It's been used in prostatitis for a while. I use quercetin quite a bit. And it also has an antihistamine benefit. So histamine are these inflammatory molecules that people get in their sinuses, but you have histamine production in other parts of the body, not just in the sinuses. That's why you go for the antihistamine over the counter, right? But you have histamine production in other parts of the body. Seems to work very, very well for prostatitis. I use spasmolytic herbs quite a bit. These are herbs that calms down muscles. I think a lot of the times that I see prostatitis is they have tight muscles around their pelvic area. Sometimes I tell my patients after an exam, I was like, look, you're a little bit of a tight ass here. I hope that doesn't get deleted. But so you have to use spasmolytic things, herbs and nutrients that relaxes the muscles. So I use spasmolytic herbs. I also use nervines botanicals. So nervines are things that relaxes the nervous system. So these are the herbs that I like to use. I love ginger. I love ginger. It's one of my main go-tos because it's spasmolytic, is also anti-inflammatory. Kava, it's also used. I use it sometimes, but kava, so when you look in the index, well, be careful because it can cause liver problems. It does not. It does not. It would not cause liver problems. And then there's a few other herbs here that Dr. Yarnell uses. And these are minimal adverse events from using these herbs. And these herbs are the pharmaceuticals used for prostatitis. Well, first of all, is primarily what's used for prostatitis is primarily antibiotics, particularly fluoroquinolones. And I say this because in about 20% of the population, fluoroquinolones could be a huge problem that it's hard to reverse. So you want to be careful. If someone has prostatitis, I would not suggest antibiotics. I repeat, I would not suggest antibiotics unless they present with fever. And even then, I would be careful. And it should not be fluoroquinolones, maybe doxycycline. Fluoroquinolones are your Cipro and Levaquin drugs, and they seem to cause damage to the nerves from oftentimes from the waist down, where they have now neuropathies and other kinds of nerve issues and ruptured tendon issues. So I would be very careful, not to mention all the gastric problems that all these antibiotics do to the patient, including getting rid of the microbiome and all these things that are important. So I would not do antibiotics. The other drug that's used is alpha blockers. This is your Flomax, right? Tamsulosin type of drug, Rapaflo. But these drugs do cause retrograde ejaculation and hypotension. Now, I said before, I'm an integrative doctor, whatever works, that doesn't cause too many side effects. So I don't like fluoroquinolones. These alpha blocker drugs are pretty good drugs in general for the prostate. Again, I go for natural, but if I'm ever hitting a wall, then with a patient, I sometimes go for a very small dose of one of these alpha blockers, and they seem to work very well. Okay, so I don't mind those drugs at all. Okay, that's a formula for urinary frequency that contains all these spasmolytic herbs. And that's from Dr. Bone from the UK, herbalist. Anti-inflammatories, I use boswellia, curcumin, ginger, and quercetin. These are phenomenal. And again, these are not your typical prostate herbs, right? You don't see saw palmetto here, but this is kind of the regimen. And you can only fit so much in a capsule, and you can only give the patient so much. So this is my go-to for prostatitis and BPH. So flower pollen extract has been used successfully for prostatitis many times. Flower pollen extract. There's not much I can say. You can read it here. There's been numerous clinical trials, including randomized trials, showing its benefit in patients with prostatitis. Okay, Graminex is the one that I use. The type of flower pollen extract that's been shown to work is Graminex. Skullcap. These are anxiolytic herbs, also known as nervines. Skullcap is one of my main go-tos for this. If the patient has prostatitis, but they're also having issues sleeping, then I give them a nighttime dose of hops, passion flower, valeria, or something like that as well at night. I'm always concerned with those botanicals causing drowsiness during the day. So I don't give it to them during the day, but I do give them skullcap or scotellaria or lemon balm as well. So, or Piper methysticum, so kava. Okay, I would give them, but my main in formulas that I've either been a part of or that formulated or that I formulate, I use primarily scutellaria as my main anxiolytic, but these others are good too. Acupuncture has been studied extensively for prostatitis. They've looked at numerous randomized clinical trials and over 400 patients by now, and it shows to be effective for pain for the most part. My experience, I'm also an acupuncturist. and I do acupuncture for male problems. My experience is that it can also be helpful for urinary problems as well. All right, prostate cancer. Oh, we're doing good in time. All right, prostate cancer. All right, so this is the most common type of cancer in men and second most frequent cause of cancer-related deaths in men, okay? 1 in 6 men will develop some sort of prostate cancer in the future. If you live long enough and you have a prostate, you're likely gonna get prostate cancer. So that's not an issue. The issue is, are you gonna get the type that will kill you? And as a practitioner who spends a lot of time with patients with prostate cancer, I will tell you this. I'm not trying to look for prostate cancer, all prostate cancer. I'm trying to look only for the type of prostate cancer that can kill you, that if we get it early enough and we treat it early, it can save your life for prostate cancer. Okay? So again, so there's these lower grade types of prostate cancer that I don't really care to find. And those I hate to find because now is like the C word, right? Only the type that can be life-threatening is the type that I'm willing to find. So I write about these things and how to go about that on drgeo.com, which I urge you, if you're serious about aging better with age, being better with age, to join my newsletter, because I think that you're going to really like a lot of the information that I send to my subscribers at drgeo.com, geo.com. Write a lot about this. In any event, here we go. So about 20,000 men get diagnosed yearly in the US. About 32 do succumb from it. Long end of this is that the United States Preventative Task Force in 2012 issued the use of PSA letter grade D, which means that it should not be used. But then in 2013, it was now a letter grade C, suggesting that this is PSA used in screening for prostate cancer is a conversation to have with the patient, doctor-patient, and it's a mutual decision that one would make. I will tell you that PSA is a very good biomarker that we want to have. Before the advent of the PSA, so the PSA test commercially became available in 1990, 1989. Before the PSA test, 40% of men who came in with prostate cancer had already advanced prostate cancer. Okay, 40% of men. That's in so that study is from like 2005. Fast forward to 2020, only 4% of men who present with prostate cancer have advanced prostate cancer. So it went down from before the PSA test for developing advanced prostate cancer, or at least for presenting with advanced prostate cancer, from 40% before the 1990s to 4% in the 2000s. So there is value. The problem is that it's been overused, abused, and misused. So with any elevation biopsies, so excess unnecessary biopsies, excess unnecessary treatment for prostate cancer. So it became a problem. So it's a matter of using the PSA test properly, not prompting the scenario of a biopsy from a PSA when just from one value. Okay. Here's a 2018 report that I think would be good for you to see. 2018 reported that there is adequate evidence from randomized clinical trial document that PSA-based screening in men aged 55 to 69 might prevent approximately only 1.3 deaths from prostate cancer over approximately 13 years for every 1,000 men screened. So for every 1,000 men screened, one can be prevented from the use of this PSA test. Okay, there's two ways to look at this. One is, oh my God, this PSA test is a complete and utter disaster. This thing doesn't work. You mean only one person you can prevent one death from every 1,000 of them screened? This thing has no value. The other way of looking at it is like, what if you're that one? What if you are that one out of 1,000? Wouldn't you want to prevent dying from prostate cancer? Right? So that's how I look at it. I look at the numbers and I look at the probabilities. It's almost like, again, something that's relevant and current is COVID, right? So very few people die from COVID-19. Certainly now with the Omicron, this new virus, but very few people die from it. But even during the Alpha and the Delta, most that were very sick, unfortunately, were the ones that were dying from COVID and unhealthy. And so the numbers kept saying, well, there's a low probability. Well, what if that number is you or your family member that you love? I have an obese mom. Thank goodness she's fine. And she's 85. If it would have been my mom, I would not have been happy with that, right? So PSA, useful, is valuable, depending on how you use it. That's the takeaway from me. And there are other tests to use that are even better these days to use them beyond PSA. Hold on one second, because I am stuck here. It doesn't seem like... Sorry, hold on. Oh, there we go. Sorry. My screen is not moving. Give me 1 second here, guys. So sorry. There you go. Okay, it's localized prostate cancer. So low risk is anything below a PSA of 10 and the biopsy is 6. Okay, that's low risk. Intermediate risk is a PSA of between 10 and 20. And a Gleason score of about 7. And high risk is a PSA higher than 20 and a Gleason score of 8 or higher. How about recurrence? So what's recurrence? Prostate cancer recurrence is when you get treated for prostate cancer and then the PSA rises again, right? So you get treated, you get a prostatectomy, all of a sudden you get it back. That happens about 30% of the times after treatment. So after prostatectomy or radiation, about a third of patients will develop recurrent, marked by a rising in PSA. Men with recurrent prostate cancer are greater of increased risk of metastasis and premature death, although hormonal therapies may extend survival in some cases. There is no curative treatment. Here's how that works. And I see a lot of, I would say a bulk of my patients have a recurrence of PSA. Natural approaches, diet, the right botanicals and exercise and good sleep is medicine. And these guys tend to live well. So, and not die from prostate cancer on average. The more you do, the better you'll do. PSA recurrence does not equate to mortality from prostate cancer. Okay, so just because a PSA recurs does not mean that one will die from prostate cancer. Oftentimes they die from other causes. So in my practice, we have protocols, lifestyle and natural protocols that are the primary intervention for many of the patients. Sometimes they are on hormone therapy and sometimes they're not, where not only do they reduce their risk of dying from prostate cancer, but they reduce the risk of dying from all cause mortality. So oftentimes they're in better health, overall health, than before their diagnosis. This is why prostate cancer, in my eyes, is or can be a blessing from the sky. It is an opportunity. Most men do not live a healthy life until they get diagnosed with something. That something oftentimes is prostate cancer, and then they're able to live longer and better as a result of this diagnosis and despite of this diagnosis. So, prostate cancer, PSA recurrence, to me, no problem. Let's get to work. All right. So, what's the type of diet? So, Mediterranean diet is always very interesting. It seems so. Mediterranean diet is a big component of the diet that I prescribe. The diet that I prescribe for prostate cancer is Mediterranean / plant-based, with emphasis on cruciferous vegetables, with intermittent fasting, with breaking the rules once a week, and what people will call a cheat day. Dr. Geo, you're crazy. Why would somebody with cancer, why would they have a cheat day? Because we are in the long game here. And the goal is to live longer and better and enjoy life. But a cheat day will promote their cancer. Where's the evidence for that? I've never seen it. But the cheat day, they'll eat a lot of junk food. They may not. They may not eat a lot of junk food, because if 6 days out of the week you're eating clean, your cheat day is just a little bit of cake at that birthday party or whatever it is that is your thing. And then you feel like you're still, engaging. Okay. Mediterranean diet lowers the risk of prostate cancer significantly. A lot of data to support it. And it does include the consumption of fish. I know that many of the talks throughout this seminar is focused on plant-based and vegan lifestyle. And I think I'm in favor of that, but I don't think it's absolutely necessary for prostate health. And I do think that salmon is an excellent choice. From the salmon, wild raised salmon is excellent, a part of a Mediterranean diet that I think that it's beneficial. The protein in it, and which is not an extraordinary amount. And yes, I know you can get many of the proteins that you need and amino acids from a plant-based diet. But I do think that a Mediterranean diet that includes fish, primarily salmon, is a good thing. So many studies and research, much of the research has shown that. The diet for and the method for prostate cancer is to make sure that we control insulin and excess blood sugar, promote the body's ability to detoxify, keep body fat low, lower IGF-1, and increase IGF. These are all seem to be protective. Okay. Men 65% or older have a 70% reduction in diagnosis of advanced prostate cancer when they apply 3 hours a week of vigorous activity. I tell my patients 4 to 6 hours a week of moderate to intense activity. So we break it down, right? There's physical activity, there's physical exercise, and there's physical training. Physical activity is really any movement. Just walking is physical activity, and that's important, but you can't just live there. So the more you move, the better you do. Physical exercise increases the intensity, a little bit more of a sweating, a little bit more of respiration increases, and heart rate increases, right? And then training is you want to get better. Physical training, you want to get better in something. You want to get stronger. You want to get be better at a sport, tennis or something. So that's physical training. Ideally, you want to dabble in all three, but certainly you want to get enough physical activity. That includes your 10,000 steps, but it doesn't stop there. You still need to do your physical exercise. So that's why I tell people physical activity 4 to 6 hours a week. And once you're beyond 6 hours a week, I don't know that you gain a lot of return from that investment. That study showed that while 70% reduction in diagnosed advanced prostate cancer in those that exercise 3 hours a week with vigorous activity, it also showed that those that did 1 hour didn't do as good versus those that did 1.5 versus those that did 3 hours. So there is definitely a higher benefit with the more you do. Okay, men on androgen deprivation therapy or hormone therapy, 3 hours a week of moderate intensity aerobic weight resistance. Weight resistance is absolutely necessary. I would argue for all men, but certainly men who are undergoing hormone deprivation therapy for prostate cancer. So before the pandemic, I used to have these retreats, and I'm probably going to start them in 2023 for men with prostate cancer, where we have is a weekend from Thursday to Sunday, and we are immersed in a lifestyle that is anti-prostate cancer, and it's exercise and cooking classes, meditation, and just a healthy, really applying all the things that I teach for a whole weekend. So here you have men in their 70s doing push-ups, and you learn how to move your body, how to exercise. If you don't, or if you already do, you know how to optimize that. So this is one of my favorite things to do, is to hold these retreats. Sugar and prostate cancer. All right, so 58% increase in prostate cancer with the intake of sugar, including and specifically fruit juices. Okay, so fruit juices. So no fruit juice, okay, and no sugar, unless on your cheat day you want a fruit juice, or a fresh squeezed orange juice is fine. Look, there's always exceptions to the rule. If you exercise for an hour with vigorous intensity and then you have a juice after that, there is no damaging effects from drinking a juice after an hour of physical activity, because your body does something different to that juice. There is no insulin response in that scenario. The insulin response that is negative is when you live a sedentary lifestyle and you're eating all these juices and cakes and sugars. Okay, so what I would say is no fruit juices or anything, but with one exception, if after vigorous training, let's say you go for an hour jog or bike riding, your body will actually tell you that you want a juice, or you want something, an orange juice or something. So then you want to listen to your body in that scenario. So it all depends. This is also from our retreat. And so we have optimal meals that include a lot of cruciferous vegetables like broccoli and cauliflower, salmon, all sorts of dips and things that are, I have a food rating system that I've developed for prostate cancer. And these are all very high on the food rating system that I have. They're all protective. And notice the salmon is not charred or burned on the outside. That's because it's poached. So it's not only eating salmon, it's eating salmon that's not with too much of the blackening that occurs when you expose salmon to high heat. That causes these hydrocyclic amines and other chemicals that are carcinogenic. That's more poached. Okay. Grapeseed extract reduced the risk of prostate cancer by 41%. So I use and I prescribe grapeseed extract. Modified citrus pectin, I use modified citrus pectin in cases where more advanced, intermediate to more advanced. About 3 times. It tends to cause some GI discomfort, so I don't use it as often anymore, but in some cases I do. All right, so let's go back to prostatitis for a second. In terms of diagnosis, well, diagnosis is that treatment includes physical medicine, trigger point release, acupuncture, and physical therapy. Herbs that I use for prostatitis include boswellia, corydalis, melissa, scutellaria, if you remember, although it's not listed here, kava, which is Piper methysticum, and ripe pollen extract. Nutrients include magnesium, theanine, and omega-3s. Omega-3s are very good anti-inflammatories. And long-term, treat the gut. So people with prostatitis often present with IBS, irritable bowel syndrome. And while we want to relieve the symptoms that are current, we also want to help them with the IBS because we think they're connected. The gut is closely connected with the urological system. In fact, when people are, one of the ways of treating overactive bladder and urinary frequency is by treating constipation because they're connected. Okay. So prostatitis, probiotics, glutamine, and eliminate foods that you're either allergic to or intolerant to. It'd be a good idea to eliminate things like gluten and dairy. I think those are pro-inflammatory and a problem. Psychotherapy may work, and ketogenic diet may work for pain. So let's talk about ketogenic diet for a second. I mentioned that here because it actually may work for pain. And in some cases, and I know that some of you are going to look at me like I'm absolutely crazy, but I don't have an axe to grind with diets. As for context, about 25 years ago, more. Okay, let's just say 25. I'm aging myself here. 25 years ago, this is where I began this natural lifestyle approach and looking into being a naturopathic doctor and so forth. And I was a vegan raw foodist at the time, which was fine. And then I learned my blood type was O, and then I ate more meat. And then I learned that plant-based is the way to go. And I ate not so much raw food, but plant-based. Then I tried Atkins and even macrobiotic for a while. So I've done a lot of these diets myself. One is to see how I feel and to try to feel better. The other is to know what it's like to do these diets before I recommend them to patients. And so I don't have strong views. I care about what works for people. And one diet, it's not the solution for everyone. The diet that gets you better doesn't always keep you well. Okay, so the diet that gets you well doesn't always keep you well. So ketogenic diet, I think there's value there for some people with autoimmune diseases and things like that. For some people with prostatitis that also present with autoimmune disease, I think it's valuable and definitely helps with pain. This is somebody with prostatitis with excruciating pain that is debilitating and they no longer work because they have prostatitis. Most of the cases of prostatitis are not that. They're mild to moderate symptoms, but sometimes it's severe. And my goal is to get them well with natural therapeutics as soon as possible. And I think some sort of modified ketogenic diet may work with for that. So that's my experience. For BPH, all right, BPH that are associated, let me be clear, this is for BPH that it's associated with lower urinary tract symptoms, not just having a big prostate. Because again, it doesn't matter. unless it is squeezing up on the nerves nearby, and then it can contribute to erectile dysfunction. Okay, so a low carbohydrate, and of course, is a low simple carbohydrate diet, right? Anti-inflammatory diet. Should focus on metabolic syndrome, obesity, and poor blood sugar regulation. That should be the focus. Nutrients to use: selenium, and remember, I use selenium, selenized yeast, vitamin D, and zinc. Phytotherapy, spasmolytic herbs. Scutellaria is my main go-to, but Melissa and Phacedia and Gelsemium, Hyoscyamus niger, all these work well. Hormone regulatory herbs can include saw palmetto and ipimedium, and anti-inflammatory herbs include curcumin, boswellia, quercetin. I also use fish oils, omega-3 fatty acids, as a anti-inflammatory agent. Other cranberry extract can help with the urinary component of things. So cranberry extract, lycopene, beta-sitosterol, ripollen extract, and reishi mushroom are also excellent. Some people that present with prostatitis have Lyme disease. So, and I know there's whole protocols for that. And honestly, I am not an expert in Lyme disease. And I've seen maybe 10 cases of prostatitis with Lyme disease that I'm managing with the help of other experts. So I wouldn't say I'm an expert in Lyme disease. I would say that I would be very careful with excess consumption of antibiotics. I know that some of the protocols include antibiotics for a long period of time, and I think that can just wreck the body. But I use herbal antibiotics that includes oregano, garlic, and olive leaf extract. Prostate cancer, Mediterranean plant-based with emphasis in cruciferous vegetables. Nutrients include selenium from selenized yeast, vitamin D, zinc, vitamin C, mixed tocopherols with gamma, not just mixed tocopherols with high alpha or DL alpha tocopherol. That's important. That's very important, actually. So you want mixed tocopherols with high gamma tocopherol. Phytotherapy, I use curcumin, boswellia, quercetin, MCP, grapeseed extract, milk thistle. I also use drawing a blank here. Yeah, milk thistle. Others, I use reishi mushroom. Yes, all the other mushrooms are good too. There's a variety of mushrooms that seem to help. But my main go-to is reishi mushroom because of the research as it relates to prostate cancer specifically. And physical activity, about 4 hours a week with moderate intensity. But again, I do 4 to 6 hours a week with mild to moderate intensity. So drgeo.com, this is a way to stay in touch. Again, I would invite you to join my newsletter. I have a podcast, the Dr. Geo podcast that just came out, and it's really doing really well. Where I'm talking about different integrative and functional methods to help people with urological problems and how to live better with age. I think that's what we're looking for. The reason why you want to pee less at night and not to go to the bathroom, 25 times a day and not get prostate cancer is to live better with age. And I certainly think we can do that. With that, I'm going to entertain some questions. You guys let me know what to do here. I know there's some questions here in the chat box. Let me know what's the next best approach.
Thank you so much for all of this, Dr. Espinosa. We really, really appreciate it. Yes, I will go ahead and get us into the Q&A. Before we get there, just to double check, we see your contact info on the screen. Is that the best place to get your book as well, or is there somewhere else they should go?
drgeo.com is everything Dr. Geo, including the book and everything. And I appreciate you saying that. It's everything Dr. Geo, drgeo.com. Yeah, and the book is at Amazon. Thrive, Don't Only Survive is the prostate cancer book.
Excellent, excellent. Thank you very much for that. And
Thank you. Yeah.
So yes, thank you for being available for our live Q&A, and we'll definitely jump into that. I'm going to explain to everybody how we go about that here in case they don't know. Generally, we don't take questions directly from the chat box. We ask everybody to raise their virtual hand. I can already see a bunch of hands raised, so
Yeah.
people want to chat. And so in case anybody's out there in our audience that is not sure how to go about doing that, you have different tabs on your Zoom window. One of them is called your reactions tab. So you just click on your reactions tab, then you'll see a function that says raise hand. You click that, we will see your hand raised, and I'll get to as many as we possibly can in our time allotted. I'll call you by your first name and I'll unmute you while I do it, and you'll be in. So doctor, if you're ready, I'll go ahead and pull in our first person.
Let's do it.
All right, thank you. So first on the list here is Janet. Janet, welcome.
Hi, thank you. I have a question. I have a 27-year-old son. He's trains excessively for Ironman competitions, you know, riding the bike on that little seat and then running. And I mean, he says, and all of the guys that he trains with say, you know, they're numb after they get off the bike for hours training. Is that, my concern is it could be damaging his prostate for later in life as he ages and continues with this heavy training, being on a bike. Is there anything that is related to that?
Janet, you're such a mom. You're such a mom. Thank you. Thank you for the question. It's actually a very good question. Let's see. He's 27 years old. So here's the deal. That's an age and stage where men are looking for some sort of meaning in life. And what's, you know, one can argue I'm still looking for meaning in life and that kind of stuff. But as you get older, you find more of those answers. 27 years old, you're still looking for that thing that drives you, that feel good, that's natural, that accomplishment, like, yeah, that kind of stuff to make you feel good, right? That's natural and it's not, you know, drugs or things like that, right? So his choice was to participate, or is to participate in triathlons. And that is incredibly satisfying for him because I used to do biathlons and so forth. So I know exactly what his experience, what he's experiencing at 27. Okay. Overall, right, what he's doing is potentially a healthy thing. I'm careful here because I don't know your son. I don't know what he's doing, right? Overall, potentially, Janet, he's probably overdoing it. Overall, potentially, he's not recovering correctly because I remember when I was 25 doing these kinds of things, I was in school and I was participating. I had to train for these things. So my training was a couple hours a day and I slept 5-6 hours. That was not a healthy thing. So my recovery wasn't good. In order for him to do this well, he needs to spend a lot of time in recovery, not just training. And in order for this to be healthy for him and his prostate. Now, the fact that he's on a bicycle and training, that doesn't mean he'll have prostate issues. He still may, I don't know. But that doesn't mean that one thing is directly linked to the other. What is concerning is the stress that he undergoes, because his body undergoes a lot of stress. What is concerning is that he doesn't recover well, because the trick is in the recovery. What is concerning, I remember, though that wasn't me at the time, but people who participate in endurance activities, they tend to have a poor diet. And they tend to not really take care of themselves because, hey, I'm burning all these calories, so, I don't need to eat well. The opposite is true. They actually need to be very careful with their diet. And the other thing is that endurance athletes tend to have a low testosterone level because their bodies are are undergoing so much stress. So their testosterone, even though at 27, is lower than what it should be. The takeaway is, it doesn't matter what you or I think, he's still gonna do what he wants to do, because there's a high that's sustainable that comes from doing such an activity, and he likes that high. I think that it behooves him to make sure to focus on recovery and to get blood work checked, so he can monitor his cortisol and a few things that he can monitor. So in order for him to do this in a healthy way, he would have to recover properly. He would have, which means eat well, sleep well, and get enough sleep, and do all these things to do it properly, and for them to be for him to do it in a healthy way, and for his prostate not to get beat up from it. I hope that's helpful.
Very much so. Thank you so much for that, Doctor. And up next, we're going to bring in Mike. Mike, welcome.
Good morning. Hi, Dr. Geo. I wanted to get your opinion on two things: testicle sunning for testosterone, and also what herbs you might recommend for thyroiditis. Slightly elevated Hashimoto's antibodies.
Mike, your first question is what I recommend for testosterone?
Well, that, but also more specifically, testicle sunning, where you sit with your testicles in the sun for a period of time.
Yeah. All right. The thyroiditis, Mike, I'm not gonna talk, because I'm not gonna answer, because I don't think I'll be able to give you a good answer. I don't see a lot of thyroiditis in my practice. I did study it, and when I first started practicing, I saw a lot of thyroid problems, but that's no longer the case. I primarily just see prostate problems, prostate cancer, testosterone, and things like that, male problems. Okay. And yes, men can come with these problems, but I just don't see it that often. With regards to sunbathing your testicles, here's the deal. I've been in natural medicine for 25 years, and I've gone to conventions, and I've heard all these things. While I am an out-of-box thinker, and I have to be for my patients, and I can kind of do things, and I recommend things that are not like randomized trials, I do need some sort of scientific support with everything I do. I think that's very important. I say that because throughout the 25 years, and I love my natural community very much, but I've seen some craziness happen out there that people are doing in hope of getting better from something. And so, and then then it has to go with it has to come to the practicality of doing some of these things. And I'm sure that some guys can hang around with their testicles floating around, exposed with, exposing themselves and, getting sun exposure to that area. I don't know the benefit of that. I don't know what it's supposed to do. I don't know. I mean, what, increase testosterone levels through sunbathing? It's hard for me to make that connection where I would ever recommend it to someone to do. So I think there are many other ways to optimize your testosterone and androgen levels. And I'm not sure that sun exposure to the testicle area is one of them.
Thanks very much for your candor on that, Doctor. And let's now go to Kim S. Welcome, Kim.
Hi, thank you so much. This has been a great presentation. My father has been battling stage 4 prostate cancer for the past 2 years, and he's a patient at Smilo Cancer Center.
Ooh. Yeah.
And he did a round of chemo, and he was pretty healthy before, but since, like what you were saying, since his diagnosis, he adopted a whole foods plant-based diet, and he's always been physically active, so that's not a problem. He's been on Lupron shots for every 6 months, and the cancer spots dramatically improved. His PSA got down to 0.5. He started Xtandi about a year ago when his PSA started creeping up. So now his PSA is 5.8, and he actually, some of the, spots, cancer spots have actually disappeared or dramatically reduced, but now he has 2 hot spots on his hip and his 6th rib. So we're looking at radiation. So is there any advice you can, or suggestions you can offer in his situation?
Kim, how old is your father?
He is this year, he'll be 77 years old. But you know what? He's in excellent health other than that. He looks amazing.
Great. All right. It obviously, as you can imagine, Kim, there's more, the devil is in the detail. There's more information that I would need to give you the best answer that I can give you. So I'm just going to go by the information that you just gave me. The first thing, my podcast actually, one of my recent podcasts is on William Hurt, and I spoke about, because he had advanced prostate cancer. So there's a lot of information there that I think will be valuable for you and for him. Bone metastasis is not necessarily a life-threatening scenario. So we want to be careful with treating every cancer spot, because there's significant side effects that can come from that. And then now his quality of life can diminish. Now, it sounds like despite of all the Lupron shots and the Xtandi and the chemo, he's still doing pretty well. And I love to hear that. But at what point will there be too much medical treatment where now his quality of life diminishes, and then, his longevity also might diminish as well? I don't know the answer, because I don't know your dad's details, the details of your dad's case. What I would say is that bone metastasis is not necessarily life-threatening. He can be highly functional with bone metastasis, and may or may not be a good idea to treat those. I don't know, honestly, but there have been cases where I've recommended against treating some lesions in the bone, because I thought that will diminish their quality of life and not necessarily improve their longevity. So I would listen to the podcast on advanced prostate cancer, where I talk about the disease itself and William Hurt's situation, which I think you'll find helpful.
Thanks very, very much for that, Doctor. And let's go now to Gail. Welcome, Gail.
Hi, thank you so much, Doctor. I would love to hear your opinion on prostate artery embolization, the PAE procedure. My husband, we've heard about that, and it sounds like a pretty amazing thing.
All right, so prostate artery embolization is, or referred to as PAE, is a procedure performed not by a urologist, by a radiologist, where they intentionally close some of the arteries that feed the prostate, so that now the prostate reduces in size, with the intention of then they'll have lesser urinary symptoms. Okay. PAE seems to be a fine approach for people with a very, very big prostate. I'm talking about 100 grams or bigger. I'm not sure that it's necessary for a man with a smaller prostate, though it can work. It's still relatively new, though the research is pretty good, showing that it is efficacious. The question that needs to be asked is his urinary symptoms related to his prostate, or is it not? And only the urologist will be able to to tell. But if he does have a very weak stream that is constantly weak throughout the day, it might be that his prostate is contributing to the urinary symptoms. Because if it's not the prostate, then let's not reconsider any of these. And you know, just the natural approaches that work very well and natural protocols, much of which I presented today. So I'd have no problems with PAE in terms of, I've recommended it to some people, but it's not a walk in the park. And yes, it's a fine approach for the right person if they take that approach, for sure.
Thank you so much. Appreciate that.
You're welcome. Sure.
Thank you indeed. And up next we have David A. Welcome, David.
Hi, how you doing? My main question has to do with exercise, and I subscribe to your email, so this is why I'm asking this question. You recommend doing 4 to 6 hours of exercise a week. Well, I could say the way some people would interpret that is do it all in one day. I believe your philosophy is to spread it out. And in fact, I think even during one day, let's say if you have an hour to exercise, I'm curious to know if you should do it in 15-minute segments throughout the day rather than just do 1 hour straight, because I think you said the body should continue to move as much as possible rather than doing all that exercise in one time. And then my second concern is you recommended fish oil. I'm wondering if algae oil is also okay, and also if you're concerned about it being rancid. And then finally, just a comment. I think one of the risk factors that I don't think you mentioned concerning whether it's prostate cancer or breast cancer are plastics.
Yeah.
Thank you.
Great. Thanks, David. So exercise, it reminds me of this notion of that men can drink up to 2 drinks a day, right? And they're fine, right? Women, maybe 1 drink or less to stay well. And oftentimes patients would ask me, well, if I don't drink Monday through Friday, can I have, 10 drinks on Saturday night? And that's the same thing, right? It's the same. So yeah, I guess there could be more clarity there. I recommend 4 to 6 hours a week of the exercise scattered throughout the week, whether it's an hour a day for 6 days or an hour a day for 4 or 5 days, then 30 minutes the other 2 days, however way you can break that down. I recommend exercise typically at 7 days a week for people. And some people look at me like I'm crazy because how can that be good for you? But I do recommend movement and exercise 7 days a week, even if it's 15 minutes. Why? A, because we're creatures of habit. And so then if you know you're going to exercise every day, you always will do it. B, because there's psychological benefit to physical exercise. So the psychological benefit of exercise to me is even as intriguing as the physiological benefits. And thirdly, because there's also physiological benefits there where you can get your 6 hours in. Okay, so I do recommend 7 days a week. And then you mix it up. So do I recommend strength training or weight training all the time? No, but I do recommend it at least 3 times a week, for example. Okay, and I hope that helps, and combined with aerobic exercise and then other things that some people enjoy, like playing tennis or things like that, that counts as well, of course. Plastics. So xenoestrogens are a problem, and it's part of the reason why men, as they age, they have higher estrogen levels. So there's 2 reasons why men, as they age, have more estrogens in their body. One is because they get fatter, and the fatter you get, the more aromatization happens, which converts testosterone to estrogen. Okay, so that's why you want to stay lean, and BMI is not enough. And just because you're slim doesn't mean you don't have a lot of fat. People are walking around that are slim fat. Okay, so their body fat percentage, though they look slim, is still 30%, 35%. All right, they aromatize as well and then create more estrogen. And the other reason is because of these xenoestrogens and plastics that we are exposed to that we should stay away from. We should be using metal containers and things of the sort. And the second question, I can't remember.
It had to do with algae oil and fish oil and the rancidity. And can algae oil be used instead of fish oil? And are you concerned about it being rancid for both?
Right. I use really good companies that I work with, and I think the really good companies do a good job on trying to minimize the rancidity of these oils. So it depends on the quality of manufacturing practices of the companies that you use. So rancidity is always a concern and an issue, but for the good companies that are out there that make these, I have no concerns for both algae or fish oil. And I think algae works just fine. Yeah, algae, which contains the omega-3s, so the EPA, DHA, and my understanding that's where fish get it from. So you're getting it right from the source. So I think that's a fine approach as well. Flaxseed oil is not. It's not that because your body has to convert that to omega-3s and EPA and DHA, and then the body may not be able to. But algae is fine, and I have minimal concerns with rancidity with the companies that I work with and that are out there, and even some of the over-the-counter companies. They do a good job. All right, next.
Thank you, Doctor. And up next we have, Stephen V.
Thank you, Doctor, for a very good presentation.
You're welcome.
I know I'm 68, 67. I have an enlarged prostate, but it's not 100 grams, it's 40 grams. I'm on an alpha blocker, and that seems to help a little bit. And I've tried a high quality saw palmetto product, it was extracted with supercritical carbon dioxide. I tried it for a year. I didn't seem to see much difference.
Yep.
I don't know. How do you think about that?
Well, first of all, your prostate is not enlarged if you're 67 and it's 40 grams. So you don't have an enlarged prostate. The second thing is that I don't know if you have urinary symptoms. I think most men in their 60s will have some. So it depends what your baseline is before you started taking your saw palmetto. If in your baseline you had frequent urinary problems and getting up 5-6 times a night, then that nothing happened after the saw palmetto, then it didn't work. The alpha blocker for urinary, so the alpha blocker doesn't shrink your prostate. The alpha blocker helps with urinary symptoms, and it does a very good job in doing so. 2 side effects that come with alpha blockers. One is 3. One is retrograde ejaculation, where you don't see your semen when you ejaculate. The other is in some people that have a history of sinusitis, then that intensifies. The sinusitis intensifies. And then the third is related to blood pressure. It can actually lower your blood pressure a little bit too much. So what I would say is that that I'm not sure that saw palmetto is working for you. I would say the alpha blocker is probably working for you. I don't know. And I would use the botanicals that I posted up on on this presentation, which includes curcumin, quercetin, boswellia, and all those. I think those work better, and a prostate support formula that contains those probably works best. I'll be writing a lot about those things for those. I think it's on Q as it relates to BPH, and it's probably on a podcast coming up soon as well. So I'll have more details, but that's a good starting point for you, Steve.
Doctor, that's great. Thank you so much. And in fact, we're going to need to bring this Q&A session to a close. We're up time for our next lecture. And sorry, I know there's a couple of dangling hands out there, folks. We try to get to as many as we can. Doctor, you've just been so gracious with your time with everybody in the Q&A session. Your very thorough presentation. We really, really appreciate you being here and sharing everything that you did. And frankly, I'm not the only one I think that wants to thank you. So we're going to have our tech.